Hi everyone, I'm Kristen Presall. Welcome to this edition of Open Line. Tonight we are talking about your eyesight and ways to improve it. There are so many different procedures out there, but which one is right for you? And what is your eyesight like? What are some of the issues that you're coping with? We're going to talk about that tonight. We're going to talk about 3 specific type of procedures with a very popular doctor who's well known here in the Nashville area. So we invite you to sit back, get all the information you can, and call in if you need to as well. All right, let me go ahead and introduce our guest. You know him very well, Dr. Ming Wang, and he has been in the Nashville area for a long time. So nice to see you. Thanks for being here tonight. You are really top-notch. So many people speak of you. A lot of people have come to see you for some of the procedures that you've helped really regain eyesight. And whether it be blurry vision or whatever they're dealing with, there's a solution for it. And we're going to talk about 3 different things tonight. And we're glad to have you back. It's been a little while that you've been on the program.
Yes, good to see you again.
And I know you've been busy. You continue to be busy. A lot of exciting new things, I imagine, over at your center.
Yeah, Kristen, you know, 21st century now, we're in year 2013, and technology has been so fast developing. Now we have vision procedure for everyone. You know, it used to be we have Lasik surgery for the young patients and laser cataract surgery for older patients, and then we have this missing part, 40 to 65. They say, Dr. Wang, do you have anything for me, you know, in the middle? And now we do have something for forever young lens surgery for the 40 to 65-year-old. Now we have something for everyone.
Yeah, and we will talk about all of these because they're all so unique and individualized, and we want to be able to let the viewers know all sorts of great information. Let's first talk about the 3D LASIK. You're known for this. You are the only surgeon in the state who performs the 3D LASIK still in the state of Tennessee. I know a lot of people come to you for that. So describe exactly what it is first. And we should probably show a slide while you do this just in terms of, I guess, the age range of a patient. If we can show that and let people know who's the best patient to go to. But explain what that is, the 3D surgery, please.
So we're starting the first group and the youngest group. The age goes from 18 to 60.
Okay.
And actually, every year, myself getting older, I keep on increasing the second number, keep myself in the young group. And so it's LASIK surgery, but we have a new technology, a new version of LASIK called 3D LASIK.
Okay.
You know, what's driving modern technology today is digitalization. We have computer, we have automation, but what underlies everything is the process called digitalization, going from analog to digital.
Okay,
you know, regular camera to digital camera. So traditional LASIK is performed with analog technology. So doctor look through the microscope and kind of eyeball things and move things around, manual. And but today we have digitalization, digital technology. So we were the first one actually adopt the digital technology for LASIK surgery. So created what we call 3D LASIK. So the first time that, for the first time when, as a LASIK surgeon, when I perform surgery, I look through a microscope, but in addition, the image of the patient's eyeball is digitally captured and amplified, enhanced 100 times on the big screen right in front of me. And it's not just a bigger, prettier picture, it's a digital picture. That means at the times when I need to correct astigmatism, I can actually import preoperative cornea topography, the map of the cornea, to align the axis of the astigmatism.
Wow.
So it brings the accuracy and precision of LASIK surgery to an entirely new height with the 3D LASIK technology. And that's correct. We are currently the only center in Tennessee offering 3D LASIK.
So what kind of eyesight issues does somebody have who gets this kind of procedure?
The LASIK surgery is typically to correct 3 conditions: nearsightedness, farsightedness, and astigmatism.
Okay.
Astigmatism meaning your cornea shaped like American football rather than basketball.
Okay.
And for all these 3 conditions in the age range 18 to 60, we have the 3D LASIK. And we found that in my hands that the percentage of patients after having 3D LASIK who are 20/20 or better is much higher than the traditional without the 3D.
Okay.
And we're just very excited to be the first ones in Tennessee to offer that.
Excellent. We do have some video, Dr. Wang, actually from your eye center. Go ahead and explain what we're looking at, please.
Okay, sure. Here we see the on the screen that I was performing 3D LASIK. You see, I was wearing sort of like a sunglasses.
Yes.
And actually, it's not a sunglasses, it's a 3D glasses. And what it does is that it looks through the 3D glasses, you'll be able to see the digital enhanced image of the patient's eyeball captured real time during the surgery, and amplified and digitally amplified 100 times. You see that the image of the
screen,
eye,
sure.
you can see it right there. And so it gives me the opportunity to see a much enhanced picture,
sure.
and it's a digital picture. So allow me to position the laser much more accurately, and also, as I said earlier, allowing us to digitally superimpose preoperative corneal topography for more accurate correction of astigmatism. And that kind of digital signal enhancement and digital signal overlap manipulation is entirely not possible without we having the 3D LASIK technology to capture the eyeball image during the surgery real time first, with the digital technology first.
That's pretty amazing. How long does this procedure take?
The procedure itself takes about 10 minutes or so, 5 to 10 minutes, yeah. And it's amazing experience. You see someone who had been blind all their lives and without glasses, and they get up in the morning and couldn't see the cloth across the room. So 5-10 minutes later, with the 3D LASIK, they sit up, they can see. It's
so incredible.
Entirely new world. And with patients with as high astigmatism, high refractive errors, not only they can see better, their visual field is expanded also.
Wow.
Because when they wear glasses, their visual field is constricted, almost like a tunnel vision, especially with high prescription and high astigmatism.
Wow. All right. Well, we have a viewer who's already called in, and that's Samantha. We want to go ahead and take her call and hear what she has to say. Hi, Samantha.
Hi, how are you?
Doing just fine. Thanks for calling. What's on your mind tonight?
Well, I had a couple questions for Dr. Wang. I'm 18, so I want to make sure that I could still qualify for LASIK. So I don't know if my vision is still changing or if I could have it. And also, I've seen his ads and everything, and I've been really doing my research. And I know that a lot of people say they're doing 3D, so I just wanted to see what the difference was between Dr. Wang's 3D and other people's 3D.
All right, great questions. Hold on the line, please, Samantha.
Good question. And Samantha, the first question regarding your being young at age 18, whether you qualify for 3D LASIK or not. Age 18 is a necessary but not sufficient condition. That means you got to be at least 18, but being 18 does not guarantee that you will qualify. We have to check your prescription to make sure that you indeed have stable refraction in order to qualify for LASIK surgery. So for 3D LASIK, 3D is a necessary condition, but we do have to see you to perform full exam to establish prescription stability before we can qualify you for 3D LASIK. And regarding second question, I think it's a very important question, because what we describe 3D LASIK performed at Wang Vision 3D Cataract and LASIK Center is a 3D LASIK surgery. But there are other doctors out there that use 3D technology to, you actually see on the screen that I'm actually doing the 3D LASIK right now. I was wearing the 3D glasses and looking into a screen with a digitally magnified image in 3D and with enhanced digital resolution and accuracy. And so this is a 3D technology used for the actual surgery. However, there are other doctors who uses 3D technology also, but not for surgery, for what we call preoperative imaging. They use 3D technologies for the corneal topography measurements prior to surgery. So the main distinction between what we do at Wang Vision Institute, the 3D LASIK surgery, and what the other doctors do is using 3D to do the actual measurements. So that's really not doing 3D LASIK. It's doing 3D pre-surgical measurements, pre-LASIK measurements. But what we do at Wang Vision is 3D LASIK surgery.
Yeah, it's pretty amazing. Well, Samantha, thank you so much for your call tonight. Of course, we have more calls to get to and more procedures to talk about as well with Dr. Ming Wang. We hope you stick around, everybody. We're going to take a short commercial break. We'll be back in just a moment. Welcome back, everybody, to Open Line. Tonight we are talking with Dr. Ming Wang about several great procedures that he offers at his vision center to folks who are having to cope with, eyesight issues, and whether, again, that be farsightedness, nearsightedness, or just blurry vision, some sort of stigmatism. Dr. Wang can definitely help you. We've been talking about 3D LASIK. We did so this last segment and showed some video, but we want to continue talking about that. Samantha, one of our callers, asked what the difference is between what other folks do, a 3D LASIK, and what Dr. Wang does. But again, there are some differences when we're talking about exactly the type of procedure you perform.
Yeah. LASIK has been around for, Kristen, about 20 years. So in the last 20 years, there has not been significant technical advancements. Until now, we have the 3D LASIK. And again, the difference is instead of analog, the traditional LASIK, we use digital technology. So 3D LASIK is a digital LASIK, and using digitalization technology to improve the accuracy, precision, and we found in my hands that percentage of patients who after 3D LASIK who are 20/20 or better are higher than traditional LASIK. And we talked about a moment ago in terms of patients, the surgeons, they're using 3D technologies. They can use 3D technology to do the measurement before the surgery, or use 3D technology to do the actual surgery. And here's the big distinction. Lots of other surgeons claim they do 3D, but they use 3D technology to do the preoperative, pre-surgical measurements. That's really not using 3D to do the surgery.
The actual surgery.
Exactly. Sure. What we do is we use the 3D technology to do the actual LASIK surgery. And that's the primary difference between other centers and Wang Vision Care and LASIK Center.
And everybody has great eyesight afterwards, yes?
Yes, very happy outcome, and I've performed over 55,000 procedures,
wow, including
on over 4,000 doctors.
Goodness.
Yeah, and we have lots of patients who are celebrities, Dolly Parton, Charlie Daniels, and Kenny Chesney, and others. So, and lots of average folks as well. So it really has made a tremendous difference in people's lives with the 3D LASIK.
Yeah, that's amazing. All right. You know what, for folks who are a little bit older, obviously there's other procedures as well. So let's talk about another one that you all also perform over at your Vision Center, and that's the Forever Young lens.
Yes.
And tell me the age range for this one as well.
It's between 40 to 65. For the longest time that when I go out to speak to patients, I say, we got LASIK surgery for younger patients, 18 to 60, and we have laser cataract surgery for folks 60 or older. But then often an audience will raise their hand, Dr. Wang, do you have for my short arm syndrome, and getting older, my arms getting shorter. And I have nothing to offer to these patients because we have nothing for this middle range, 40 to 65. And since I had nothing to offer to patient, I would say, it's really not your eye problem. As you're getting older, your arm's getting shorter, that's all. And so I call you short arm syndrome. It's not my eye problem. So now we do have something for real to help them.
And I know we have video of this as well, if you can kind of describe what we're going to be looking at here.
Yes. And this is actually describing the Forever Young lens surgery, the new surgery that we are presenting to the state of Tennessee. And currently, Wang Vision is the only center in Tennessee that offering the Forever Young lens surgery. And it consists of 4 different parts. One is what we call smart eye surgery. You're actually watching the surgical scenes of smart eye surgery. Second is the 3D high definition digital technology. And number 3 is the laser Forever Young lens surgery technology. And number 4 is the laser astigmatism correction. So as you see, the word says operative. So this is the technology. You're actually watching a digital technology instrument that image the eye. You see the light that goes into the eye and gets reflected back and onto an instrument, then is deflected through an optical pathway, and then it's come back through an optical pathway, hitting what we call a grid, and the grid is generating what we call the interference pattern. The interference pattern gives you the measurements of patient's prescription. When you go to an eye doctor's office, you get all these instruments in a big room and all the measurements, devices. But what we have here is all these technology in doctor's office and instrument room, all miniaturized, digitized into a tiny little box, as you see. And this box is mounted on a surgical microscope and during surgery. And this technology is called smart eye surgery. The reason called smart eye surgery because it's like a smart bomb. You know, smart bomb used by U.S. military. A smart bomb can be shot up into the sky. It could be blown off the course by wind, but since it's GPS guided, it can always come back and find the same Iraqi target. So it can do the mid-flight adjustment. Wow. And that kind of capability to do mid-surgical adjustment is what the smart eye surgery that we have, and we're the only center in Tennessee has this technology. So rather than we wait for weeks to months after surgery and then find out the lens that we implanted did not work for the patient, in smart eye surgery, we actually do a test drive on the operating table before surgery is finished to see if the lens we implanted works for that patient, and do the adjustment right then and there on the operating table before the patient leaves the operating room. So this is the smart eye surgery. This, what we just saw, is the forever young lens surgery. And this for the age range between 40 to 65. And the principal benefit is to treat the short arm syndrome. That is, enable this group of patients from 40 to 65 to be able to free the dependence on reading glasses and bifocals.
Will you not ever need lens surgery again then after having something like this?
And that's the good thing about the forever young lens surgery, that once a patient had the forever young lens surgery, this new surgery, that they will never need cataract surgery again because the lens has been replaced with a lens, what we call forever young lenses, give you simultaneous distance and near vision. So it's a new surgery. Wow. We're just presenting to the state, to all patients now. And it is only offered at the One Vision 3D Cataract Laser Center because we have these components. We are the only center in Tennessee which has all the components that the smart eye surgery, the 3D, the laser lens surgery, and the laser cataract surgery. Together is what's formed the Forever Young Lens Surgery. And as such, we're excited to be the first and only center presenting to our patients to enable the 40 to 65-year-old to be able to throw away reading glasses.
Yeah, and great results with this as well, right?
Yes, very exciting.
Okay. All right, well, let's go back to the phone lines if you don't mind, Dr. Wang, and we'll talk with another viewer, and that is Monica. Hi, Monica.
Hi.
Thank you for holding. What's on your mind, ma'am?
Well, my mom's eye doctor has told us that she has cataracts that need to come out. Okay. And I, myself, I work in the medical field, so of course I'm up to date on all the newest technology and everything, but I'm concerned, you know, because they haven't been doing it that long, and how do we know, you know, that it's safe to use, and, you know, what are, I guess, the benefits of that in opposed to traditional cataract surgery, which is obviously a lot cheaper and billable to insurance.
Yeah, it's a good question that and you asked a question, Monica, with regard to the safety and the advantage of laser lens surgery that we talk about. And the principal advantage of laser lens surgery, and in this case we're talking about laser forever young lens surgery, is safety and precision. Because laser beam is much more precise and accurate than a human hand. And the traditional lens surgery, cataract surgery is performed with a blade, involve the risk, involve any blade operation. But with laser, we have been able to significantly reduce the risk, improve the safety and accuracy of the procedure. So we are actually, One Vision actually was the first center in the state of Tennessee to introduce the laser lens surgery, laser cataract surgery. And currently, majority of doctors, almost everyone else, are still using blade to do cataract surgery. And we're very proud to be able to offer that. Actually, we talk about the smart eye surgery, the forever young lens surgery. We called also Charlie Daniel procedure because he was one of the first in the state to have that procedure.
All right, Monica, did that help you out?
It did.
Okay.
I guess I only have one other question. I've been listening to the show, and I know that, you know, using the laser, you said that the post-op is, you know, has been proven to be more successful, you know, than traditional LASIK and everything. So I was just wondering if that applies with laser cataract surgery as well. Have you noticed in your post-op patients a higher level of recovery after using a laser?
Yes, Monica, that indeed we have observed an improved speed of recovery, and patients after laser lens surgery, laser cataract surgery, and also with 3D LASIK, all of these technology has one common thread, which is laser. And at One Vision, we are the laser eye specialists. We perform almost all of our vision procedures with laser. So with the accuracy in laser, we have been able to improve the vision in our patients, but also the speed of recovery is much faster. Most of our patients with 3D Lasik, forever young lens, laser surgery, and laser cataract surgery have been able to return to work practically the next day. As I said earlier, I have performed these laser eye surgeries on over 4,000 doctors. And almost all the doctors return to see patients doing their procedures on the very next day.
Very good.
Oh, that's great.
And Monica will be talking a little bit more about laser cataract. I know that that's what you're interested in most. We'll be actually showing some video that Dr. Wang brought. So that'll be the next segment that we do after the next commercial break. So stay tuned for that. And thank you very much for calling. We want to take another phone call, and that's from Tiffany. Hi, Tiffany. Are you there, Tiffany? All right, I'm going to put that call on hold real quick, and we'll go to Brandon next. Hi, Brandon.
Hi.
Thanks for calling in. What's your question for Dr. Wang, please?
Sorry. I saw the ad where you mentioned that you were the first in the state to do laser cataract surgery, but I've noticed other surgeons are making the same claim. Are you still the only one doing it?
Good question, Brandon. That this is concerning laser cataract surgery, but it's the same vein as laser lens surgery. Yes, One Vision was the first center in the state of Tennessee to perform laser cataract surgery. And currently, as I said, most of other centers are still using blade. And at the same time, your question is excellent. There are other surgeons who mentioned that they are performing laser cataract surgery, but in reality, they're using laser to only cut the outer coating of the eyeball. You know, in the human eyeball, the outer surface is what we call cornea, and the lens is situated inside of the human eye. And cataracts are the opacification of the lens itself inside of the eye. So you can use laser to just make a cut on the cornea on the surface. That's really not laser lens or laser cataract surgery. It should be called laser corneal incision. And since the lens sits inside the eye, the cataract lens, in order to do laser cataract lens surgery, the laser has to go inside of the eye, actually hit the lens and do the surgery. And in that sense, we were the first in the state of Tennessee to perform laser cataract lens surgery. Actually, I ask all patients who have similar type of questions to ask the doctor who claim that they're doing laser bladeless cataract surgery, to ask the doctor a very simple question. Said that, does your laser that you're using for presumable laser cataract surgery, does your laser actually go into a human eye, touch my lens, the cataract's lens, inside my eye? And you know, I'm sure those doctors are good folks. They're honest. They will tell you, no, I just use a laser to cut the cornea on the outside, and that's really not laser or bladeless cataract surgery. It should be called, truthfully, laser corneal incision.
Very big difference. All right,
Yes.
Brandon, thank you very much for calling in. We're going to take another short commercial break. When we come back, we will talk more with Dr. Wang. Don't go away. Welcome back, everybody, to Open Line. Tonight we are talking with Dr. Ming Wang about a lot of the different procedures he performs at his Vision Center, and really learning some great information. We've talked about the 3D Lasik that he performs, as well as something recently, the segment before, we talked about the Forever Young lens, and we've been showing some video as well that Dr. Wang brought, and it's just really fascinating to watch just how you can improve your eyesight within a matter of minutes. It's pretty miraculous. So Dr. Wang had mentioned that he has worked on a lot of the country music artists too here in town, and one of those gentlemen being Mr. Charlie Daniels. And listen, he's been in the business for quite a long time, but you guys helped improve his eyesight. And talk a little bit about what you were telling me during the commercial break, which is kind of interesting.
Charlie was one of the first in the state of Tennessee to have the smart eye surgery, the laser cataract surgery.
Okay.
And so we now colloquially call it the Charlie Daniel procedure. And he had a bad eyesight for 68 years. You know, if you remember, you saw his old performance there with hat, with sunglasses to kind of protect his eyes. And now he had the laser cataract surgery with smart eye surgery technology. The other day I was just seeing him that he could actually see when he performed all the way across the whole auditorium, all the way back, and at the same time look at his music sheet at the same time, in the same eye. So when was the last time that we could do that in the same eye? It was much, much younger. So it's an amazing result with a smart eye surgery laser cataract.
So everything that you're used to or accustomed to is just changed instantly because you get some of these procedures done.
Exactly.
It's pretty remarkable. Before we get to another phone call, obviously you still visit with Mr. Daniels. Are people coming back? Do they still have to check in with you just for eyesight and just to make sure everything's going well? How often do they do that?
Typically yearly, and one of the major things that we do is that I tell every patient, once I do a surgery for you, you are your visual happiness is my responsibility. That means I'm not just doing a surgery, I'm actually following you for the rest of your life to make sure that you continue to do well, and any other eye disease, illness developed, we are taking care of you. And I told Ms. Daniels that after surgery, I'm going to take care of you for the next 50 years.
Very good. I hope everybody thinks that that's going to be happening too. All right, let's go back to the phone lines because I know we've got a couple more viewers who have called in, and we'll start off with Tiffany. We've got her back on the line. Hi, Tiffany.
Hello.
Thank you for holding.
I'm really glad I got to hear what you just shared because it kind of is the age range I am in. I'm about 48, give or take a year or two. I will not share that. But I am kind of experiencing the distance and the up-close issues. So I really have a hard time with both, obviously. At my age, reading is one of the main ones, but even driving at night. So, but no cataracts or anything like that. But I went to a Lasik consult one time, and they told me that the only thing they could do was monovision, or whatever that is, but I would lose something in distance and up close, and there's no way I could adjust to that. So is there anything, like the Forever Young thing, would that work for me?
Excellent question, Tiffany. Yes. After so many years, I have to say no to patients for the 40 to 65-year-old range patients to be free of reading glasses and bifocals. Today, for the first time, we have a positive and good news for you, for patients like you in this 40 to 65 age range. Yes, at One Vision, we now have a new procedure called Forever Young lens surgery, and we are currently the only center in the state to have that procedure to enable you to be freed of dependence on reading glasses and bifocals. And what this Forever Young lens surgery is a surgery consists of 4 parts. The smart eye surgery we saw a moment ago with the video, the intraoperative mid-surgical adjustments on the operating bed before surgery is finished, so we know where the lens we put in the eye actually works for the patient rather than wait for a month afterwards to find out it doesn't work, have to go back to the operating room. And 3D technology and laser lens surgery and laser astigmatism correction. So we're the only center in Tennessee which has these 4 combination of 4 procedures. So yes, for you to get rid of distance and the near vision, LASIK will not cut it. LASIK is principally for, as I said, 18 to 60, and mostly 18 to 50 or so, that mainly to improve your distance vision. And for some patients, we can do monovision. You mentioned monovision to one eye distance, one eye near, and some patients that work pretty well. But for those folks that sounds like you're not a candidate for LASIK because you don't like to be doing monovision, and also you don't like to have both eye corrected for distance, so your reading glasses dependent. In that case, up until now, in the old days, meaning up until last week, we had no treatment for you. Now we have the Forever Young lens surgery for you, which for the first time enable our 40 to 65-year-old to be freed of dependence on reading glasses and bifocals, to reverse your age clock by 20 years, and we call it tapping the fountain of youth. So we can help you now.
Pretty terrific. All right, Tiffany, thank you so much for holding and for calling in tonight. We're going to take one more call, and then we're going to talk about laser cataract surgery, which is something also that Dr. Wang does over at his center, Vision Center. So first we'll talk, though, with Helen, and then we'll talk about that procedure. Hi, Helen.
Hi, how are you?
Doing just fine. What's on your mind, ma'am?
Yes, I know that Dr. Wang is one of the best surgeons, but I know that he does surgery on, like, celebrities and people that, you know, a lot of people know about. So it makes me think that maybe he's expensive, and I just want to ask him why I should come to him when I can go somewhere else and have it for less money.
Excellent question, Helen. First of all, there are two issues. Number one is vision. Second is cost. And regarding vision, vision is one of the most important senses as a human being. So we always stress to patients that the quality of sight you will get at One Vision with 3D Lasik, the Forever Young lenses, those procedures, we are the only center in Tennessee offering that give you the quality of sight. And patients come from all over the world to Nashville and to our center for that procedure. So always remember, the quality of sight is the most important. The way we practice medicine in our center is I will only offer to you, as my patient, the procedure that I offer to my own family member. And does the quality make a difference? Absolutely. One time I did have a patient ask me that question. He said, Dr. Wang, it's the same type of surgery, LASIK surgery, cataract surgery. What's the big deal difference between one doctor to another? Same principle of surgery. And my answer was, if I asked her, I said, let me ask you a question, madam, that playing golf is the same principle. Throw a little round little ball into a little round little hole. Same principle of the game. So what's the big deal difference between you playing golf between you and Tiger Woods? So just like golf, there are just as much difference among doctors in terms of quality of sight, technologies, and quality vision they can provide for you, as there are differences among golfers playing the same game of golf. So that's most important, equality. How do you do your homework? And number one, you need to ask other doctors. Ask as many doctors as you can. Ask your own doctor. Say, Doc, have you had eye surgery? Where did you go? If you're going to have eye surgery, where will you go? And second is to ask your own doctor or any doctor you're considering objective, not subjective, objective question. You cannot go up to the doctor and say, hey, doctor, are you any good? No, you have to be objective. You have to say, doctor, do you have 3D LASIK for LASIK surgery? Second, do you have Forever Young lens surgery to get rid of reading glasses between 40 to 65? And for older patients, do you have laser for cataract surgery? That's an objective question. You get to get a sense if the doctor is updating technology. Second question you ask is very important, is cost. And One Vision, we are affordable. We make every effort. We have different price range, and depends on patient's need and the prescription range, the length of follow-up needed, and we customize each of those packages for patient's need and depending on their range of affordability. So in the end, we have a happy patient with good visual result at a cost that they can afford.
Very good. All right. Thanks so much for calling in. We appreciate your time tonight, Helen. We're going to move on and actually talk about laser cataract, because this is the last procedure we'll talk about tonight. Of course, you can always get more information on Dr. Wang's website as well as visiting him at his office. But let's talk about laser cataract, because this is the procedure. We've talked about all the different age groups so far, but for folks who are 60 and older, and this impacts them a lot. And I know we're going to show you again one more time the screen that kind of tells you about the age range for laser cataract.
Yes.
This is for 60 and up, most of your patients, correct?
Yes. So far, to recap, Kristen, younger group, 18 to 60, 3D LASIK, 40 to 65, the new Forever Young lens surgery to get rid of the reading glasses. Now we talk about older group, the third.
Okay, we've got video here to show everyone as well.
Perfect. So I'm going to describe, what you're watching is what we call laser cataract surgery. 15 years ago, vision surgery went from blade, RK, to laser, LASIK, which revolutionized our eye care, and the millions of patients obtained LASIK surgery and totally changed their lives. So 15 years later today, in cataract surgery, the same revolution is taking place, this time in cataract surgery from blade to laser. And traditional cataract surgery is performed with a blade. You have to using a sharp instrument in the eye, and sometimes it can damage the surrounding structure of the eye, causing complications and problems. But today, as I said earlier, the 21st century, we live in the digital technology, laser. So therefore, we have this technology can actually use laser to perform the cataract surgery. So this is a machine you're watching. We were the first one in Tennessee to have the laser cataract surgery technology. As I mentioned earlier, a moment ago, that even though some other doctors said that they are using laser bladeless cataract surgery, but when you really ask them, are you using the laser to go into my eye to do the laser cataract lens surgery, they say, oh no, I'm just using laser to cut the cornea, to do corneal incision. So, truthfully, that's really not laser cataract surgery, but laser corneal incision. But at One Vision, the distinction between that and us is we use a laser to actually perform the cataract lens surgery. That means here you can screen with a laser to actually make the incision on the surface of the lens that go into the eye, make incision surface of the lens, and the fragment the lens, and they enable us to perform the procedure much more accurately and precisely. You know, when patient comes to us, want to have cataract surgery, seniors, you know, grandma, 75 years want to have surgery, and their daughters and sons are coming, and what's the priority? The priority is safety. They want to have their grandmom and have vision improved with safety. And that's the principal reason why patients have come from all over the country and all over the world to One Vision to have laser cataract surgery. And we were the first in the state to have laser cataract surgery, and currently most of the cataract surgeons in the state, as well as in the United States today, are still using blade to do surgery, and only less than 1% of the surgeons actually use laser for cataract surgery. And so here you actually see the actual surgical procedure. Patient is lying on the bed underneath the laser. I step on the foot pedal, and the laser goes through the cornea. Now you see laser about to enter in the eye now, and it's actually going to make a circle, you will see. And that circle is critically important because that circle determines how the lens you implanted is going to sit in the eye, and also the quality, the astigmatism, the prescription of vision of the patient after surgery. Traditional blade cataract surgery, the doctor uses a blade to make that circle, and sometimes by freehand you cannot make a perfect circle, offside, oval, different shape, and cause visual problems in post-op in patients. With laser, we make those incisions on the cornea, as you see, the lens fragmentation and the circle, and so we can improve the accuracy and precision of the cataract surgery to an entirely new height with laser cataract surgery.
And that's really what you've been talking about all evening, is it's not just the cornea, it's the actual lens, and that's what you really need to make sure. That's what the doctor is going in and adjusting and taking care of.
Yes, that's the principal difference. Yeah, lots of doctors say, I'm using laser, I'm doing bladeless cataract surgery, but the distinction is, do you actually use the laser to go into the eye, touch the human lens? The opacification of human lens is cataract. So in order to do laser cataract lens surgery, you have to go into the eye. You cannot stay on the surface on the cornea.
Absolutely. All right, we've got to take another short commercial break, Dr. Wang, but when we come back, we'll talk more about laser cataract surgery, and we'll also talk with a couple folks. Christy, Garrett, I know you've been holding on the line. Hang on just another minute. We'll get to your calls as well. We'll be right back. Welcome back, everybody. We want to show you again our slide that talks about the different age groups in terms of which procedure might be right for you. And I'm going to have Dr. Wang explain these one more time, especially talking about the laser cataract surgery. You mentioned that that's 16 up, but kind of talk about these again, Dr. Wang.
Yes. So before we spend more time on laser cataract, so once again, you know, callers, they're sitting there, you know, I'm not that old yet.
Yeah.
Basically, for 18 to 60, we have 3D LASIK and the digital LASIK, and as I said, we're the only center in Tennessee offering that. And for 40 to 65, that's the new procedure that we talk about today, the most exciting, the forever young lens surgery, to enable a patient 40 to 65 to reduce the dependence on reading glasses and bifocals, something that we have never had anything until now. And again, One Vision is very proud to be the only center offering forever young lens surgery. And now we, you know, spend a few more minutes to talk about the older folks, you know, someone who is over 60, and that's cataract surgery. Again, the key difference between laser cataract surgery, as we saw in the video, and the blade cataract surgery is the safety, the precision. And we found also in the visual outcome as well in our patients. And we were the first in the state of Tennessee to introduce laser cataract surgery, and still, it's less than 1% of doctors in the country are using laser. Others are still using blade. Blade can be used. It's you know, but however, if my parents want to have cataract surgery, I will want to send them for laser. As I said, our practice principle at One Vision is we'll only offer to patients what we offer to our own family members. And one thing I always said a moment ago, is there's a big difference among different doctors, different technologies, even the same type of surgery, LASIK or cataract surgery. It's just like, just with the same principle playing golf, there's a big difference between different people playing golf. vast different qualities.
Absolutely. And with the laser cataract surgery, just pointing out the accuracy and the precision that you all do with the laser, that probably takes away from a patient having to come back and sitting in that chair again. Years ago, we used to hear how people would have to get the cataract surgery done again, but obviously that probably doesn't happen when you're talking about this procedure.
Now with the laser cataract surgery, and basically after cataract surgery, the patient will never develop cataracts ever again. And one of the advantages, I was lucky in a sense because my prior training was in laser physics. I obtained a doctoral degree in laser physics first, and then I decided to go into medicine, so I got my second doctoral degree in medicine at Harvard and MIT. So now
you could combine
combine them. So I was lucky to be able to combine medicine and high-tech laser to be a laser eye specialist for our patients.
And a lot of other people lucky to be able to get the procedures done by you. Okay, let's answer a couple more phone calls if you don't mind. I know a couple of these folks have been holding for a long time, and we'll start with Christy. Hi, Christy.
Hey, thanks so much for taking my call.
Yes, ma'am. What's your question, please?
Well, you know, me and my dad just moved to Nashville, got some family here, and we're just, you know, we're looking around, and he's got cataracts now, and he had Lasik, you know, back in the day, and we've been asking around, and our doctor told us that, you know, there's more of a chance of complications because of the Lasik if we choose to move forward, you know, with cataract surgery. And I was just wondering if there was anything you could tell me, you know, about that.
Excellent question, Christy. That we're talking about here a very special type of cataract surgery, post-LASIK cataract surgery. Those folks they were younger 15, 20 years ago, they had LASIK surgery, and now they're getting older, they have cataracts. Most of the doctors, most of cataract surgeons are not as experienced in performing cataract surgery on post-LASIK patients because the technical challenge is higher. It's more difficult to perform cataract surgery on a post-LASIK patient because the cornea, the eyeball has had surgery before. So therefore, the cornea has been modified with prior LASIK procedure. So the lens accuracy of the lens calculation for cataract surgery is more challenging to do. However, Wang Vision is an international referral center for post-LASIK cataract surgery. We actually get cataract patients sent to us by over 24 of cataract surgeons in this part of the country and around the country who they do cataract surgery, but they don't like to, they're not as experienced in performing cataract surgery for post-LASIK patients. So we'll be delighted to see you, your parents, and for post-LASIK cataract surgery. And in that particular case, post-LASIK cataract surgery, the laser cataract surgery, its advantage of accuracy and precision is even much higher.
All right. We want to, again, show you the slide regarding the patient's different ages, if we can, just talking about these procedures, because we've talked about every single age group, and we've talked about which procedure would be right for you. But we want to just reemphasize again that middle age group that really, for the longest time, there wasn't a whole lot being offered to folks who had needed the reading glasses and had some sort of vision complication starting a little bit middle age and up. And that forever young lens surgery is really something new. And you all have been doing that for just a little while, but it's made a big difference for a lot of folks.
Yes, and again, it's the most exciting because we used to have this disconnection. You know, for younger folks, 18 to 60, we have 3D LASIK. For older folks, 60 and up, we have laser cataract. But when somebody says, Dr. Wang, I don't have as much cataract, need medical cataract surgery yet, but I certainly am feeling the impact of my aging, and particularly I'm developing the short arm syndrome. And as I said earlier, that it used to be we have nothing where I say, well, I can lengthen your arms, that's about it, you know. But now we actually have something to help them, this middle age group, 40 to 65, to be freed of dependence on reading glasses and bifocals. And that is a new surgery that we talk about today. That's the most exciting news today, is the forever young lens surgery. And it consists of 4 parts: the smart eye surgery we saw in the video, the intraoperative on the operating table adjustment, rather than let the patient go home and adjust later, and do a mid-flight adjustment and before patient finished the surgery, and the laser lens surgery, the 3D technology, and laser the cataract with the astigmatism correction. So this is a combination of these 4 unique advanced technologies that they form together is the forever young lenses. And as such, we are the only center in Tennessee that provide the forever young lens surgery. So it's exciting that we have those now to actually fill the void in the middle. And I think it's just so exciting for folks no longer, you know, if you're 51 years old, 55 years old, you don't have to just kind of settle for, you know, the aging process and not being able to enjoy LASIK and not quite old enough to enjoy cataract surgery. At Wang Vision, we are the only center in Tennessee offering forever young lens surgery to enable you to be freed of dependence on glasses, reading glasses and bifocals, tapping fountain of youth, and reverse your aging clock by as many as 20 years.
Tapping that fountain of youth. We love to hear that. And I'll tell you what, again, we want to just mention that all of these procedures don't necessarily take a whole lot of time at Dr. Wang's office at the Vision Center, and really the end result is pretty remarkable. Recovery time is not that bad for a lot of these. You can get back to work pretty quickly, and we're going to want you, if you have any kind of questions or comments after this program is over, to go ahead and contact Dr. Wang. We're going to be giving out some information in terms of how you can do that and find out more information about tonight's program. We'll do that right after this commercial break, folks. Don't go away. Welcome back, everybody. We've been talking with Dr. Ming Wang tonight, and of all these wonderful procedures, what would you say, besides all these exceptional procedures, what separates your Vision Center from a lot of the other places that do different things like this?
I think, you know, Kristen, that what sets Wang Vision apart, we talk about 3D LASIK for young people, forever young lens, the new surgery for 40 to 65-year-old for bifocals and get rid of reading glasses. What sets us apart is the quality of service, the dedication to our patient care, the education, the knowledge, and the sense of responsibility. We want to provide the best care. As I said, our principle is I'll provide to my patients what I provide for my own family members.
Very good. All right. And having said that, we're going to show you some information in terms of how you can get a hold of Dr. Ming Wang. Take a look at your screen, folks. This is the information number. If you would like to call his Vision Center, you can do so by calling 615-321-8881. Again, 615-321-8881. 8881, or you can go ahead and go online right there to one of the websites for more information. We want to thank Dr. Ming Wang for coming on tonight. Pleasure seeing you, sir.
Thank you, Kristen.
Thanks so much. Some great information tonight. I know I learned a lot. Don't forget, folks, Southern Woods and Waters is coming up next. Have a great night.